you noticed something here? Well, first we need to have this leg into there. Good. All right. So, good. So, front of the legs and thigh. Who would need massage that area? Runners, dancers, cyclists.
Rugby.
Yeah. So sports. Yeah.
People who work in catering or
Standing.
Skiers.
Standing. Yeah.
nurses.
Nurses, deliveries, postmen, and people who kind of use the lower body a lot. Yeah, so let's look at the muscle group that we have on the thigh. Quadriceps. Wonderful. Good. Group of 4 muscles here. And we have a Sartorius muscle. Yeah, good. We have the adductors that are on the inside. And on the outside, we don't have a muscle, but we have a piece of connective tissue. Iliotibial band. Yeah. Iliotibial band is start below the knee, goes all the way to the side. Yeah. It's like piece of connective tissue. And you know what it does? If you don't have that or you're losing it, then it kind of let the hip flip to the side. So it kind of keeps the hip. So when you're walking, look, you can do that, but it keeps you there from moving and moving to the side, the whole hip. Good. Sartorius is another interesting muscle that you don't.
Curves, doesn't it?
Yes, it kind of curves from here to there, and usually you don't feel it because it's very thin. Yeah. And on the leg, we have the iliotibial band. Sorry, the tibialis anterior. Tibialis anterior, that in front of the chin bone. Yeah. Oh, I can feel that. Yeah. Good. And that's the only required muscle. Yeah. Good. Now draping. Draping. You come. You fold that to around here, and before that you could take the leg a little bit to the side. Thank you. And try to do that with a one movement. The upper part, the upper hand stay there, and the lower hand move just as much as the towel covers the heel. That's it. And then what you do, you just go and tuck it underneath. Again, okay? Yeah, good. You're having 2 hands. One, first you take the leg to the side a little bit, and then the top hand stays. It's like opening the door like that, and then you tuck that on the opposite leg. And you could start by getting some sensation. Yeah, you can do some of the rocking technique we've done now with a little bit of pet massage. So I feel tibialis anterior needs some work. Yeah, in here, and then kind of go, maybe relax that and see how the muscle move. Okay, if you want, generally you can do a little bit of nice movement, or it's another way of just assessing. Okay, so what I've got is tension here and on the quads. Effleurage, right? Legs are long, so just be sure that if you can't cover the whole leg, then you can do it in steps. Yeah, you just step and continue, and then coming back, or just do the leg first and then move on to the thigh next. Yeah, continuously I'm assessing. I'm still assessing and feel right relative to what I felt on the 32 people that I massaged so far. It's kind of on the hard side, so maybe I can work more into that area. Is it too much? Let's ease off a little bit. Okay, so you do more of the effleurage and then start the pet massage. So figure of 8. Nice ringing. In the ringing, really, you could take even the hamstring from here and just squeeze the muscle all the way. And then the other hand is on the hamstring, and then you do it again. So right hand on the back, and then the left hand is on the back. Yeah, a lot of body movement. It's interesting because in the final exam, what the examiner is saying, that the effleurage usually is very good posture-wise, but when it comes to the more deeper technique, it all becomes kind of, oh, I forget it a little bit, so try not to. Okay, you're thinking this area feels a little bit cold, you can do a bit more deeper effleurage even. You know, I want to increase blood circulation. It feels too tight, yeah? How's that? Can I go a bit deeper or? Okay. What you find out that if the area is tight at the beginning, the more you work, the better it gets. So don't be afraid of engaging there. Okay. I find more tension around the knee area, then actually I move into compression. It doesn't have to be kind of a preparation. All you do is just naturally move on to the next level. Good. And a bit more of a petrissage. It's always nice to look at the client, to get the painful face scenario. Yes. We're very expressive around the face. That's really the use of face. So it makes sense to always kind of look at what happens. Sometimes I see kind of therapists usually kind of treating there and thinking, okay, well, you can do the same thing, but now you. I think also energetically it opens that they see you. They're a lot more approachable. Okay, so after that you can do some vibration again. A bit of more shaking. Okay, now let's look more carefully at the muscle structure there. We have the quadriceps, which start actually from the hip and goes all the way below the knee. The muscles on the inside, when you want to treat them, what you do is turn the leg a little bit to the side. You can do that by having one hand here, and then the other hand really free to do petrissage. Yeah. Now try not to have the leg too much this way, because it will put this muscle into stretch, and then it will be very tight. So keep it kind of a little bit in a neutral position, a little bit turned out, yeah? Good. And then you can really kind of lean into it. Around the knee is a special area when you feel a lot of tension of these muscles, yeah? So really feel, I'm on the bone here. This is the femur, and I really feel the attachment.
Looks nice.
Yeah, and again, is it relaxing? Yeah, but I'm very specific. It's not just kind of moving on. You know, I really look into specific, and it can be relaxing. Good. So this is on the inside. You can do figure of 8, yeah. You can do ringing again. You can do finger kneading. Good position to work in here. Yeah, good. The inside, you need to do pretty much the opposite. You need to turn the leg and you holding the ankle. To see if I'm holding the ankle, I'm in a good position to work more into here. You might want to come around and see it, yeah, from here. Now on runners, that area usually would be very tight, and you can do a really relieving technique in here. Now, I must warn you, it can be very painful for the client, but very beneficial for knee pain, because the iliotibial band go below the knee, and if it's very tight, it just whack the knee out of alignment. But also back pain and hip pain. So all this pain around here, and even lower back pain can be, yeah? So you just hold your hands like that. You can use, at the beginning, just like kind of a deep effleurage. If this is fine, you can move on to the knuckles. And at times, it really depends on finding the right depth. So at the beginning, I would work very superficial, a little bit faster and warm it up. And then after that, slowly in. Now, if I want to make it deeper, all I need to do is just ask, can I go deeper? Yeah. And now, is it okay? Can I go deeper, or that's it? Good. So this is the time that you have to be absolutely so much in contact with them. Okay. You can do as well, coming from here, and you have very easy access to the outside. Yeah? All you do is just really having your hands very easily accessed to. So, base of the wrist down, figure of 8, knuckles.
How high up do you go? Because it gets a bit tender here, doesn't it?
You go to the greater trochanter.
So that hollow.
So it's where the bone ends in here. Okay. Last is the let's change. Right? Last is the front. The front of the leg has not much. It just has more the outside, because the inside is the chin bone. Yeah. Can you all try the inner side or the front? Inner side is closer inside. Do you feel the bone there?
Yes.
And go on the outer. Do you feel the bone there? Can you do all dorsiflexion, this movement? Can you feel this muscle tightening when you do it? So this is what tibialis anterior does. It raises the leg into dorsiflexion. So you just follow the muscle. Really follow the muscles. You can do with knuckles. Or you can come from the opposite side and work it. Just a nice, easy way. All the way down. And it's kind of end up here with tendons. And the tendons kind of go. Good. We'll do the feet some other time. Yeah, I think it's more than enough. And let's... any questions before? Yeah?
When you do the calf, do you still turn the leg?
No. When you do the calf, it can be kind of neutral, in a neutral position.
Okay.
Oh, the calf, the back?
Yeah.
Well, I haven't done the calf now. What I've done is just the front.
Well, I suppose that's at the back, isn't it?
Yes. But what you can do, if you want, you can do that. You might need to take the pillow for that. You can come and sit on the lightly on the legs, and then you can do everything. You can do the calf in this position. You can do the calf in here. You can do the quads and the hamstring. So you can, if you don't have time and somebody really wants their legs to be done, and you don't have time to turn them, and you just need to do that kind of in a one position fits all, then you can do it this way. Yeah. Just be careful that you don't ask them to let their leg fall into the side, because they will contract the muscle to keep it. So you have to be also kind of see that it's, yeah, remember what we did? Yeah, keep the leg kind of relaxed. So just move it so the leg is still relaxed.
Can you also add vibration? And
Yeah, of course.
everything?
Yeah, we've done it at the beginning, this way. Yeah, this way, that way. Yeah, could be a good start or end for that. Shall we start?
Yes.
Yeah.